When you have a patient in your office who's interested in a refractive surgical option to be able to get out of contacts and glasses, you may wonder when the EVO ICL would be a great option, or who is an ideal patient for the EVO ICL. Well, the EVO ICL has been a really wonderful alternative for our patients. It is approved for treatment of -3 myopia to about -16, and it also comes in a toric form that corrects astigmatism of up to 4 diopters.
Yeah, it's a really fantastic option for myopic correction. And one of the questions we also often get asked is, can the EVO ICL treat hyperopia? The answer to that is no. In the United States, you can only treat myopia, but you can treat up to -16, as Neda mentioned, and also down to about a spherical equivalent of -3. And so some of those patients who are low myopes, or patients who are low myopes and have high astigmatism, as long as the spherical equivalent's around -3, they would be candidates for the EVO ICL.
It's a great option for patients who have at-risk corneas, a patient who has formed fruus keratoconus that we detect here in the office during their consultation using tomography and other advanced diagnostics, detecting any posterior elevation of their cornea. Any patient with moderate to severe dry eyes, someone whose dry eyes does not respond to them being out of contact lenses and who may need added treatment. A patient with known keratoconus who has had collagen cross-linking with stable keratoconus could also be a fantastic candidate for the EVO ICL.
Yeah, that's a great point. Those are patients who sometimes are otherwise not candidates, or at least safe candidates for laser vision correction. And so all of those are great ICL candidates, as are patients sometimes who have normal topography, normal tomography, but their corneas are just on the thinner side. And for them, the EVO ICL is also a fantastic option. Now, assuming the refraction is well within range, corneal imaging, anterior segment exam is normal, two big things we really consider in terms of patient candidacy is the dilation. How much is the patient dilating? Because the patient's pupil needs to dilate to at least a certain amount in order for us to safely get the ICL in the eye. And another factor we often consider is how much room is there in the front of the eye? We need to have enough anterior chamber depth to safely place the ICL in the eye, and we measure that through our corneal imaging, through our biometers, through multiple anterior segment devices. And so actually, as we plan the ICL surgery, the patients are getting multiple testing, pretty much as we get for patients who are having cataract surgery or refractive lens exchange.
So whereas before really corneal refractive surgery was considered mainstream, the EVO ICL has really become a wonderful option for our patients. And I feel very strongly, as I'm sure that Arjan does too, that in order to offer us the safest approach surgically for refractive correction, you really need to have the EVO ICL as part of your surgical armamentarium, because it allows you to offer the full spectrum of options to patients. And if a patient sits in that gray zone of safety for one surgical option, you're not biased towards that. So when a patient comes into our practice looking for refractive surgical correction, we use our expertise, diagnostic tools, as well as all of the different surgical options that are available to really fit the right option for the patient, to give them the best vision possible with safety in mind.
Yeah, you make such a good point. One of the things I really love is now in this modern era of refractive surgery, we really don't need to be taking on cases where maybe the patient is a borderline candidate. If the cornea is too thin, something's off with the corneal topography or tomography, the EVO ICL is such a safe and fantastic option for vision correction. We no longer need to be put in those situations where we're trying to decide, is a patient really or truly a safe candidate for laser vision correction? And so that's just one of the many benefits of the ICL technology.